Joining me now to give us an important update on medical assistance in dying in Canada is Rebecca Vachon, Director of Health at Cardus. Welcome to 100 Huntley Street, Rebecca.
Thank you.
Rebecca, just recently at the end of 2024, the government released information about the impact of medical assistance in dying on Canadians and what that progression has been like. What can you tell us from this report?
Yeah, so the report came out about what happened with MAID in 2023 specifically. And what it shows is that MAID has continued to rise year over year. Work that Cardus has done has shown that we have the fastest growing assisted dying program in the world. We are now only second to the Netherlands in terms of euthanasia or MAID deaths as a percentage of total deaths. So in Canada, we were getting close to 5% last year. At 4.7% of total deaths in Canada in 2023 were from MAID. So this is really showing the juxtaposition between what Canadians were promised by the Supreme Court and by the original legislation, namely this is something for exceptional circumstances in the rarest of cases in this environment of heightened safeguards. And the reality has been that this is something that's routine. This is something that has just been accepted as normal and that many Canadians are receiving instead of a natural death.
And sometimes, too, instead of receiving the health care they need, or receiving the resources they need for housing or well-being. In fact, some Canadians have sought out to choose MAID or have been suggested to have it MAID administered to them.
Yeah, one of the things that we see is that the Health Canada reports talk about the nature of suffering that is indicated by those receiving MAID. And we see that so much of it is social suffering, not about the symptoms, not about the physical pain or whatnot. And we've seen that has increased over time. So in 2023, there was an increase in the number of people who reported social isolation and loneliness as part of the cause of their suffering. And when you look at the difference between Track 1 and Track 2, so Track 2 MAIDs are for those who are not actually dying. They have suffering caused by a condition, but they are not actually having a terminal diagnosis. Their death is not reasonably foreseeable. And when you look specifically at that group, it's over half of them were reporting that compared to closer to the 20% mark among Track 1. And so that really speaks to some of the marginalization concerns that are surrounding persons who may be accessing MAID because they don't have sufficient disability care support, for instance, or sufficient social support, and as a result are turning to MAID.
Well, in Track 2, tell us a bit about who that would include.
Right. So Track 1 was for those whose death was reasonably foreseeable, although that's still quite a vague criterion. So for Track 2, your death doesn't have to be reasonably foreseeable. So it essentially includes anyone with a kind of disability or chronic condition who feel that they are unable to relieve their pain in a way that's acceptable to them. It's important to note that you do not actually have to have tried all of the available treatments or options. Canadians, by and large, seem to think that's what it's for, that you can only receive it after you've exhausted everything else, that it's a last resort, but you only have to be offered. And if you haven't meaningfully experienced proper disability supports care or adequate high-quality palliative care, then it's not really a meaningful offer. If you've been told you've been waitlisted to receive, for instance, that accessibility mechanism for years and years. So that offer isn't really meaningful because they can't necessarily change that reality for you anytime soon. And so people are turning to MAID as an alternative, but it's not like other healthcare because it is the end of care. It ends with the patient's, the end of their life.
And Rebecca, in 2023, 15,000 Canadians died by MAID, which is a very, very significant number. And 100 Huntley Street over the last year, we've really been speaking loudly about the governmental push to open up MAID for those whose sole underlying condition is a mental health issue. And so we know that that was delayed, that law from going through for 3 years, but we're 1 year in already. So 2 years from now, those who have mental health issues could apply for MAID and die by MAID. Rebecca, talk to us about what's at stake there and what Canadians can do today facing this issue.
It's such a huge expansion. We already know that people are accessing MAID because of their mental illness, but they have to have other physical conditions to qualify. Allowing it for persons whose only source of suffering is that mental illness can open up the eligibility so much wider. And we know that the question of irremediability is one of the criteria to access MAID. And there's no agreement in providing mental health care that something is irremediable. There's always something new that can be tried, an adjustment to your medication, a new type of therapy. Some of the challenges are really about the barriers to mental health care that people face or that lack of social support. And so it is, again, is really problematic to open up this expansion when we don't have adequate mental health care. Cardis did surveying with Angus Reid Institute, and one of the really interesting conclusions we found was that the majority of Canadians want us to address the mental health care needs before we expand MAID. That is not what that legislation is going to do, and so we need to listen to Canadians on this.
And I think that's something Canadians can speak loudly about in the public square, but also in their churches, in schools, and we can share about this vision of expanding mental health resources for those who are having those kinds of challenges. Rebecca, something else that's of great concern is Quebec allowing advance requests for MAID. And what does that mean? What does that mean for the everyday Canadian?
So this is actually something that's quite unique in the world. There are very few jurisdictions that allow advanced euthanasia requests. And what it means is that someone can, years before they might actually receive MAID, make the decision that in such and such circumstances they would like to be euthanized. There are so many issues with this. For one, part of the whole premise and the safeguards surrounding the law on MAID was that you need to be able to consent. You have to have autonomy. And that means being able to consent immediately prior to receiving MAID, because we recognize sometimes we change our minds on these things. Now, this would effectively remove that requirement and allow people that no longer have capacity to make decisions to be euthanized. It is such a difficult situation because there's so much stigma surrounding things like dementia and Alzheimer's. And there is research that shows that what we maybe from the outside assume about the quality of life of someone living with that can be very different from what they're actually experiencing. And it can be very difficult for people outside, including clinicians, to actually interpret the wishes of people who are, for instance, no longer able to verbally communicate that. And so when you're introducing this, you're essentially taking someone's prior decision, which might be based on stigma, it might be based on fear. You've just received this diagnosis and you don't really know what life is going to look like for you. And you're making a decision based on that, not on what you are actually living with at that present moment. And I think that's a really troubling thing and something that we need to address, especially when we already have issues with MAID safeguards, with MAID monitoring, with transparency around this. So we really need to look at how is the system working or not before we continue opening up expansions to those who are incredibly vulnerable in that question of autonomy.
Rebecca, that's true. You know, putting in an advance request to receive MAID based on an Alzheimer's diagnosis or something like that, and then changing your mind potentially 20 years later, but you're not able to express that you've changed your mind for various reasons. Rebecca, in the 9 years that since MAID has been made legal here in Canada, what has surprised you about the progression of MAID in our nation?
I think it's sad to say that not a lot has surprised me, because these are the concerns that were raised before MAID was introduced, upon the legislation being introduced. And with each change we've seen, it's just confirmed what our fears were. I think that something that has surprised me in a good way has been the really diverse coalition of people that come together to raise concerns about vulnerable Canadians. This has been a really tremendous opportunity to work with people across different political views, across different faith views or non-faith views, but who are united in the common cause that life matters and we need to be good to one another, and that includes protecting our most vulnerable, especially from a premature death.
Rebecca, thank you so much for sharing with us today and for all you do to help protect Canadians from the realities of MAID, as well as the Cardus organization. We're so thankful for the partnership with Crossroads and talking about these issues. And you talked about the power of unity. And it is a silver lining in how we can take action to protect Canadians from MAID. Thank you so much for being with us today, Rebecca.
My pleasure. Thank you.